What can healthcare professionals, how can they build trust and a rapport with their patients and with each other? What are some of the ways that you would train them or suggest to them to actually develop the skill set that they can utilize in their day-to-day work with their patients and with each other?
Caring interactions, therapeutic interactions are not necessarily intuitive. There's a lot of development and training of healthcare professionals that's technical in nature, and relationships are just supposed to happen because people are caring people and they're in healthcare. And we know that's not the case. For some, it is more intuitive than for others. So creating kind of a framework within which you can intentionally connect. And it's both simple and it's complicated. The simple part is connectivity happens when we're there, when we're attuned and present. And it can happen in a moment. I have many examples of that from our own care experience. It can happen in a moment, or it can set you up for dissonance between the caregiver and the patient in moments. The reason it happens in a moment is the patient and family members are highly vulnerable and highly vigilant. And so they're attuned to what's going on and constantly kind of filtering, am I safe? When care providers approach with an open mind, open-heartedness, and a willingness to connect by listening, safety or a sense of safety can be established very, very quickly. When they approach without that kind of authentic connection, the dragon for the patient, the danger, 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 I may not be seen, I may not matter, therefore I may not be safe, is stirred. And so the relationship then can be subtly more complicated or more dramatically become complicated. Some of the meltdowns that we hear about in healthcare, I think if you go back to the source of origin, it's in those initial connections that answers the question, am I safe or am I not? So one of the approaches we've taken, there are several, but was the therapeutic framework. So am I attuned? Am I here right now? Am I leaving the last patient behind while I'm here with you? Secondly is, am I open and curious? Do I think I already know about you, or am I willing to learn? Because without learning, I can't then know what's right for you. I can know what your diagnosis is, but that does not tell me what's important to you. And that's the third practice we identify as following. So what are we hearing and what is important to you? If you attune, wonder, and follow, if I'm here, if I'm interested, if I'm listening and attending to what you're telling me, and then I work with that as I care for you, I'm holding you in my care, which creates safety. Holding also is clinical competency. You know, you can count on me because I'm competent what I'm doing. You can't undersell that, how critically important it is. We put this framework together because that's what we saw when it worked. It's not that we invented it. It was describing what happens when it works. I'm there, I'm interested, I'm listening, and I'm holding you with intention. That can happen in moments. One of the worries people have is I just don't have time to connect with people in this way. But as they practice the skills, these happen in moments. It's not does not have to be an extended period. And I can give examples of that. But I'd love to hear your response to that, Lola, because I know it interfaces so closely with the work on emotional connection.
Well, I like what you're saying, am I here for you? That's a very big question. Am I emotionally present with you?
Yeah.
Can I leave the previous patient, and be with you?
Mm-hmm.
Am I listening to you? And I think, am I listening to you not only what you're telling me in terms of your content information, but am I listening to your worries, to your concerns, to your fears? Can I really pay attention to the facial expression that is happening with you? That I can pick up some cues what you
Right.
maybe are feeling, but maybe you not really know how to share that with me? Can I hold that space for you that you feel comfortable, or like you said, held, that you do feel held?
Right.
That's huge. That's huge. For people to be able to do that, our work comes again back to the teamwork, because in order for you to hold your patient, to hold their experiences, you have to be balanced.
Right.
You can't. Otherwise, you'll go very fast. You will miss all the cues, and you'll just want to get to the solution or to the whatever the protocol you have to follow, without really giving that presence, that emotional responsiveness and presence that the patient and their families need. So I think we focus a lot on that relationship within the team. And what's interesting about it is that